Okay, thank you, thank you, thank you very much. Okay, guys, let me turn down the music and then we'll start. Okay, today we are talking about how to know if you are depressed. A lot of people talk about depression and they say, I am depressed, and all that. We're going to know what depression is, and we are talking about clinical depression. Clinical depression. Now, let me put a caveat up here. This is not designed to be a diagnosis. There are a lot of things that the psychiatrist or the doctor has to ask you in order to make that determination. But at least the idea is to give you some preliminary idea whether you are a professional, you are one suffering from it, or you're just a caregiver, a parent, community leader, a religious leader. People come to you and they say they are depressed. How do we know whether it's the normal, common depression that people experience, or this is one that requires medical attention? We get depressed from time to time. We could be depressed for a few days. That's not really clinical depression. But there are 8 things that I'm going to mention today that are common symptoms and signs of those who are depressed. They experience this. But the key word I want you to remember is that these things have to persist over 2 weeks for you to say, this is really clinical depression. In other words, if you're sad 2 days, it's really not depression. Maybe, maybe not. If something is bothering you and you are quiet and you're lacking energy for a couple of days, 3 days, that's not the depression we are talking about. The depression we are talking about has to have these 8 things. Number one thing that those who are depressed clinically suffer from is sleep disturbances. It's called sleep disturbances. Increase or decrease in sleep. For those who have depending on the disorder, it may be lack of sleep, inability to sleep. And I'm talking about you fall asleep, you wake up, you can't go back to sleep. For some, they cannot go back to sleep at all. They stay late, and then when they sleep a couple of hours, they are up. So any kind of disruption or disturbance of your sleep length, meaning how long you sleep, how deep you sleep, and when you sleep. You can't do any of those things, then that's one sign. The next sign, which is heavy in a lot of people who suffer from depression, is lack of interest in the things you normally enjoy. You are someone who enjoys watching football, watching movies, you're an outdoor person. Suddenly, you have no interest in doing that. You have a social person, you like to socialize. Suddenly, you don't like to be out there. You want to be by yourself. That's a sign of anhedonia or isolation. Now, that's separate from seclusion. Isolation is you getting away from people. You getting away from people, not being wanting to be around people. I have patients that would run to their apartment if they live alone. If they live with people, they run to their room. If they share room with people, they run to their bed. They are in their bed, not wanting to be disturbed. That's a sign. That's isolation. Isolation, not engaging with people, and you're a people person. Third one is guilt. That is excessive guilt. You feel guilty. You feel guilty for nothing. You feel guilty for something. You don't know why it is, but you feel just a sense of guilt, like pervading sense of guilt that you have. That can be accompanied by shame. That could be accompanied by whining. Why did I do this? Why am I causing problems? A lot of my patients say, I don't want to be a burden to my people. I hate being a burden. I hate being the only one that everybody has to care for. So that sense of guilt is there. That's number 3. Number 4, which is more observable. The guilt is the person who knows it. The 4th one is observable by people around. The loss of energy, lack of energy. You don't have the energy to engage in things you normally do. You want to do it, but you really don't feel like getting up from bed. I have had clients who are normally hygienic, they do a lot of self-care, they take care of themselves, they like the environment clean and speaking, but suddenly they have problems just taking a shower. I think the longest I've seen in group session is someone who said, I didn't take a shower for 2 weeks. Maybe there are some who have done more than that. For 2 whole weeks, I didn't take a shower. I didn't want to get out of the bed. I just got up out of my bed, went to the refrigerator, grabbed whatever I can, ate, and then went back to bed for 2 weeks. That's all she did, or he did. So lack of care, lack of energy to do anything, fatigue, and disinterest. No one need to groom. When I do my assessment, that's one thing that I observe. The grooming, the dressing, all those things are indications that something is going on. The person doesn't really care about those things. At the back of him, his mind knows it's right, knows not taking a shower for 2 weeks or 1 week is not good, but you're really not motivated enough to get up and do it. So lack of energy is number 4. Number 5, having difficulty concentrating, lack of concentration. You want to focus on things, your mind is running from here to there. Difficulty concentrating. You can't read. Sometimes you don't remember something. You're having memory problems. You're thinking, when was the last time I took a shower? You can't remember. Days roll into nights. Nights roll into days. You're not really connecting with life. Lack of concentration or difficulty with trying to concentrate. That's a problem. And number 5 would be lack of appetite. Appetite may be increased. In other words, you're eating a lot, or it may be decreased. In other words, you don't feel like eating. I had a patient last week who said, I only eat once a day, and it has to be something that appeals to me. If it's not something that appeals to me, I'm not hungry enough to overcome that interest. I can't just eat anything. It has to be something. And usually it's the same thing. This patient drinks a glass of milk every day, and that's it. If there's no milk, she doesn't feel like doing anything. But if she sees milk, glass of milk, and maybe with a couple of crackers, and she's done. She has to be forced or kind of encouraged to eat more than that. So lack of increased appetite is something that we observe in those who are depressed. So that was number 7. That was number 6. And number 7 is psychomotor retardation or activation, slow physical and mental functioning. Slow physical and mental functioning. You can't just wake up and do things. You can't think straight. You ask the person question, they are slow in answering. They are slow in processing their thought. Slow in doing that. That they may pause a while before they answer you. If you're not schooled in it, you might think this person is playing games. But they're really trying to process their answer. So it's not that they are playing games. They are processing what to tell you. So that's why they are slow in responding. So as a clinician, I ask the question, I observe, and I give them time to answer. I might follow up with a second, a follow-up question in that same line, so that I'm sure that what they are giving me is what they really need to give me, not what they just want to give me because they want to me to get off their back. So I'll follow up. So lack of motor retardation, or rather an activation of motor retardation, slow physical mental function. If they get up to work, They're not gonna run. They're going to be very slow, holding things gradually, it's very slow. That's one of it. And then the final one, number 8, is suicidal thoughts. Not everybody has that, but that's the final threshold for a lot of people. And there are a lot of levels of it. Thinking suicidal ideation, thinking with a plan. Some people might think, I wish I would go to bed and not wake up tomorrow. That's the ideation. They're really not thinking about killing themselves. And then the next level is, I wish I have a means of killing myself. I want to kill myself and end it. That's the next level. The other level is, I have a plan to kill myself. I wish maybe they look around, they see a bunch of medications that they take, and then they begin to think, if I take this, I wonder if it will kill me. It will be enough to just knock me out. That's now having a plan, and a plan that is available. Oh, I know that there's a gun in my house. I have a handgun. I wonder if I'll just use it and blow up my head. Now we are going to the final stage. Well, not only are we thinking about dying, we're thinking about killing ourselves. We have a plan. The plan is available and accessible. It's in the house. There's a gun in the house. The medication is in the house. All I need to do is to activate it. I want to hang myself. And there's a lot of things that they can hang themselves with. So suicidal thoughts and feeling of hopelessness. That's really where that is coming. I have an assessment that I do. One of those assessments would say, do you feel trapped? 80% of my patients would say, yes, that's how I feel. I feel like there's no way out. I'm going to be going through this. I went through this last year. I've already gone through this all my life. I feel that there's no way out of this situation. So I might as well just end it. There's no way out. Feeling trapped is one reason why people think I might as well do it. The doctor said there's no cure for my mental illness. I just have to manage it. I don't want to live like this. If this is what life is, I really don't want to do this. That's feeling trapped. That's feeling hopeless. I can't do anything. Somebody told me, I think that was early this week, he said, I lost my job, can't keep a job. I've gone to 3 kinds of training, 3 kinds of schools. I quit. I didn't finish any of them. I've lost my marriage. I've lost friends. I don't have friends. What am I living for? So that sense of hopelessness, there's no purpose for me to live. I might as well feel it. Often they are not saying it as I'm saying. They are thinking it in their head. They are going back and forth thinking in their head. But there are telltale signs that they will verbalize. That if you pay attention, you will see, you will have an eye view of what's going on in the head. If they begin to say, I really don't want to be a burden. I really don't want to be a burden anymore. That feeling like I'm trapped. I don't want to continue to be a burden. If the person continues to talk about now, I was talking to a patient 2 weeks ago, young girl, and she said, I was asking her, what do you want to be when you grow up? She said, nothing. I haven't thought about what I want to be. And I said, why? Every young kid dreams of being something or being somebody. He said, because I can't, there's no future for me. I don't think I'll be there in the future. So I'm not thinking about what I'll be. So because I'm not going to be there, I don't think I'm going to be there. That's dark. And this person has attempted a few times and been unsuccessful. So she's still not seeing that. That's a dark place. So these are the signs how to know when or if you are depressed. For those who are just joining us, number 1, sleep disturbances. The person is going to struggle, either sleep too much, sleep too little, or sleep and can't go back to sleep, or can't sleep. When they sleep a little. Lack of interest. This is an avid football player, an avid sports person, avid outdoor person. Friends are social there, and suddenly they have no interest in that. They want to be by themselves. They cut off from their friends. They see friends call coming in. They won't answer. That's one of them. The feeling of guilt, pervasive feeling of guilt, and this feeling that I am a problem. I did something wrong. I'm not good. I'm not worthy. Number four, lack of energy. Lack of energy, easily fatigued and disinterest. You start watching the movie with them after a minute, they're not in it anymore. They're not. It's not catching their interest. And this is someone that watches a movie all day. Suddenly they don't have interest. Lack of concentration, difficulty concentrating on something. They want to focus. Obviously, at this time, they can't read a book. So if you say go read a book to distract yourself, it's really a difficult thing. What you can encourage them to do is do coloring, listen to music, those kind of things that they don't have to focus. Coloring, music, take a walk, those can help. And lack of appetite or increased appetite, that's one sign. And then the seventh one is psychomotor retardation, slow physical and mental reaction and response. Slow physical mental reaction to things or response to your question. So even when they want intentionally respond, it's going to be slow. Slow physical movement, slow physical thinking. And finally, the last one that I was talking about, suicidal thoughts. So if you're here, these are the ways we know. There are 8 of them, they are not exhaustive. But for clinicians, again, I'm not a doctor, I am a clinical mental therapist. So for those who are thinking, am I in it? Remember, these symptoms, at least some of them have to be there for at least 2 weeks for you to say, yep, I think I'm probably it. I need to go see a doctor. We're still not saying it is, but there's a greater chance we are going there. I need to go to see a doctor to make a definitive diagnosis on what I am going through. It could be other things. That's not all it could be. But if you have these signs, if you have a patient who says, I have this sign, or if you say, have a patient who comes in and says, I think I'm depressed, these 8 points are things that I'm going to assess on. I'm going to assess them on quality of sleep, how well they're eating, how well they're resting, how well they're engaging. I'm going to assess them on concentration. All those things would help you to refer to a psychiatrist or an MD to make the final determination if you are a clinician. Obviously, this is for you. This helps you a lot. If you're a mom, this helps you to assess your children at the preliminary one to know when to seek help. If you are a pastor, people come to you for prayer. This helps you also to know when to refer and what to pray about. So these are it for knowing when you are depressed. If you are here and some of these things are things you like to get skills on, you like to know more, arm yourself better. During the COVID, obviously, we all realized that there are things that happen, we will be on our own. Everybody, including the doctors, went to their house. So you were on your own. So if you can't make these preliminary determinations, you are on your own. So it's good to know, to be armed. Obviously, if you're a coach, you're a counselor, you're a mentor, you're a pastor, you are deal with people who come to you. You are a school proprietor or proprietor. People come to you, people depend on your opinion, and you want to know. We have a 14-week certification course that is certified mental health and addiction counseling course that would give you the basics. You'll be able to analyze and you'll be able to diagnose at least know who is suffering from alcoholism. Now that I test that could be done, that is the preliminary one. You will know. You will know who is suffering from drug addiction. You'll be able to know the interaction, the role that families play in causing people to get addicted and in helping people to go through recovery. The dance between the family and the addict. You will have that. You will know how to set up your own clinic. If you're interested, how to set up rehab, how to set up outside practice, you are a coach, you want to incorporate this in your practice because you're seeing a lot of people who are suffering from mental illness. There's a component, a whole module that we are going to talk about mental health diagnosis. And then some of these things we talked about will be expanded. We're going to talk about depression. We're going to talk about anxiety. We're going to talk about the other ones. We're going to talk about relapse prevention. Remember, mental health is a lifelong thing. There is no one cure, no pill, no injection, nothing that the doctors can give you and they say, oh, you will never deal with depression again in your life. It's over. Or nothing that the doctor, anybody can give you that says you were addicted to alcohol, you're never going to be addicted anymore. You can play with it, go drink. You're not going to be hooked to it. Nothing. What we do is recovery. So you're going to learn some relapse prevention tools and strategies. We'll give that. That's a new thing we're adding. I talked about I talked about suicide. You're going to know the risk factors to suicide and suicidality, the warning signs to suicide and suicidality, and how to help someone who is either actively planning or who has just planned failed, and how to help them recover. All this is covered in the course. It's a 14-week course every other Saturday. 2 Saturdays in a month. That's what we do. And then we start from now, you end in June. It starts in January 24th. It's not really that intensive, but it gives you the tools that you need. We've had doctors take this course because doctors are saying, I went to med school, I really wasn't taught anything about addiction, alcoholism. That wasn't our curriculum. So I want to learn, it's not what I do, I'm a family doctor, but I want to add it to the repertoire of what I do. If you're a nurse, obviously rehab is your thing. You want to open a clinic, a lot of youth, a lot of people are suffering from addiction now. They are suffering from drug addiction. That's the skills that you want to have. You are a pastor, you already have a facility. You already meet people. People come to you. These are skills that you need. Proprietor and proprietress. If you have kids who are dealing with addiction and mental illness, this could be a separate service that you offer to parents for their children and to children so that they can continue to function and be effective in the class. So we have these classes. If you're interested, the stuff Chris has just posted, you can reach out to us. There's a link there. You join that class. This is the spring classes starting January 24th, which is not this Saturday, but the next Saturday. We kick off in full. So you join us, it's not late. Some may be asking us how much is the money. Really not a lot. The money is spread over the 5 months. You put down a deposit, the rest of them you can pay as you go. Why are we doing this? This course, where I live in Houston, Texas, it's anywhere from $5,000 to $15,000, depending on which school you go to, for you to get it so that you can get licensed. I'm not saying you're going to get Texas license. Licenses are monitored, licenses are supervised and issued by states. It's a state thing. You don't live here, you're not going to get that license, but you will get the knowledge and the skills. It's the same curriculum that they use that we are going to be using to teach this class. At the end of it, you can set up your own practice. At the end of it, you can enhance that, add that to some of the services you offer. Drug counseling, alcoholism counseling, and mental health help. So that is it. If you're interested, again, the phone number is there. Copy that phone number and reach out to us. Let me see what, okay. Not just phone numbers, there's a link that you click, and I think that link will take you to either WhatsApp or to leave us a message or to fill a form. There is 2 numbers. If you're from Southern Africa and you don't want to reach some number you don't know, There is a 27818244642 number. That's the Johannesburg number. You can reach here, there. She can speak Zulu. She can speak any of the languages you. You want to reach your own person. Or if you are from Western Africa, all the other side, and you want to reach someone whose number you're familiar with, that's a number 903-141-6971. That's Chris. Chris is in Lagos, Nigeria. So you can reach him, or just reach Tifa. You're saying, I don't know these numbers. I'm not sure of them. I want to reach a number that of the person that I'm seeing. Just reach Tifa. Number you reach my wife's number 713-498-6211, or me 281-701-7850. So any of these numbers can avail you. We can answer your questions and provide you with information that would help you make a decision. But let's go. The idea of this business is not a money thing for me. If I really want to make a money thing, I'll do it here in the US. That's where you get paid a lot. But I do realize that Africa and a lot of third world countries have great shortage of therapists, especially trained ones. Also, shortage of psychiatrists, especially trained ones. All of them are trained. So we have shortage of those. This is our base to arm you, to give you tools to help yourself, help your family, help your church community, help your local community, help your friends and family, so that we'll begin to have a grip on mental illness and addiction. Up till now, it is a quagmire. It's a difficult thing for a lot of people to come to concept with. So that's why I'm doing this broadcast. That's why we're offering those courses. So click that link and join us, and we'll see you. God bless you. I will end here. I'll see you all next Thursday. I'm going to be talking about anxiety. Anxiety is the one for me as a clinician. That's the difficult one to deal with. Depression, I know what things that I can do, but anxiety, it's almost like you hit on it, especially those who are suffering from extreme anxiety. Next week, we're going to talk about how to know if your anxiousness is anxiety, how to know if this is something you suffer. If you are suffering from MDD, which is major depressive disorder. It's for most of the diagnosis is a combination of anxiety and depression. So you're gonna have those. It depends on which one is more. So next week we talk about that. Thursday, same time. See you here. Bye-bye.